Welcome to the Cystic Fibrosis Foundation's virtual patient education day, using nutrition to stay healthy with cystic fibrosis. Sponsored by an unrestricted educational grant from Genentech. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast will focus on how you can stay healthy through nutrition. Our presenters are from the Children's Lung and Cystic Fibrosis Center at the Women and Children's Hospital of Buffalo, New York. Dr. Drucy Borowitz is the director of the CF Care Center. Chris Coburn-Miller is the dietitian for both children and adults with cystic fibrosis. And Joe Cronin is the director of the Adult CF program. We will now answer questions that have been submitted during registration and during the live broadcast. I encourage you to continue to send your questions in during this question and answer session. Remember, we will not be giving any medical advice, nor will we be answering questions that do not relate to the topic of nutrition. So the first question I'd like to ask is, what specifically makes a child with CF not grow?
I think we think of that as in three big categories. So you may not gain weight because you don't take in enough calories. You may not gain weight because you're not absorbing those calories, and even when we use enzymes, they don't work perfectly, and there are other reasons why people with CF don't absorb nutrients. And then the third thing is maybe you're burning up too many calories. So infection or inflammation in the lungs use up lots of calories and can burn up calories while you're just sitting there. So again, thinking about being proactive, you can only control what you can control. So the things that you control are to take in enough calories and extra calories, just as Chris showed you, through adding extra nutrients or adding extra fats to every meal, or as Lisa explained to Joe, making sure that you plan those meals and snacks. You want to make sure you're absorbing your calories, so taking enzymes with every meal and snack. That includes supplements, it includes milk. And then the third thing is to do whatever you need to do to control lung infection and inflammation, airway clearance, regular exercise, taking your CF medicines.
Another question that came in is, should you take all of your enzymes before your meal or periodically as you're eating your meal? Is one way better?
I mean, I think that there's not a lot of good science. The usual recommendations are to take your enzymes with the meal. That might mean right before the meal. Some people split enzymes, so some of them are taken at the beginning of the meal and some in the middle. We know for sure it doesn't really help to take enzymes after the meal because they're sort of chasing the food down your intestinal tract after the horse is out of the barn. So that doesn't make sense.
Well, we're on enzymes. This person sent in a question with registration. We read that people with CF should never take generic enzymes. Why, and what kind of enzymes should they take?
I'm going to answer one last question here, and then I'll let you guys talk. So, when you open up enzymes, they are these little encoded or encapsulated beads. And the reason that coating is there is because if enzymes hit acid, like for example the acid in the stomach, they'll just stop working. That's just part of how they are as chemicals. So they have to be coated in something that's resistant to acid. When people have generic enzymes, if you look on the side of the bottle, it'll say it has the same amount of lipase, protease, and amylase as a brand name enzyme. But we don't know that the coatings dissolve in the same way, and at least as of June 2007, there's no FDA regulation that talks about how well things dissolve. So we know that brand name enzymes will dissolve in the right place. We don't know that that's true for generic enzymes, and in fact some generic enzymes just don't dissolve at all, and so they really don't work to help people absorb food.
One last follow-up on that.
Sure.
Is there any evidence that generic enzyme cause liver problems or cirrhosis of the liver or elevated liver levels?
Yeah. Enzymes are a very old medicine. They were on the market long before the FDA came into being, and so we don't have a lot of good safety data on them. We don't know whether enzymes have any relationship to liver problems at all, although we think that most of the liver problems in CF are directly a result of CF. So there's no real way to say whether generic enzymes cause liver problems. we do know that they've been associated with people not growing well and even intestinal blockages. So again, our recommendation is to make sure people get brand name enzymes.
What effect does 3 servings a day of dairy have on people with CF? Is there a negative effect getting all that dairy, since you hear in the news that you should, watch your dairy, not eat as much, high-fat foods? Does it have any effect on people with CF?
No, it shouldn't have any effect. And the nice thing with dairy, it has a lot of calories in it. You compare like skim milk to whole milk. Whole milk has like 60 more calories in it in a cup than skim milk. And all your cheeses and stuff are really good ways to add extra calories. So there's really, no reason to limit your dairy. And also it's a good source of calcium, and calcium is an important nutrient to have, throughout your lifestyle, whether you're a male or female, ways to hopefully prevent osteoporosis. So there shouldn't be any, limit on the amount of dairy that you take in during the day.
I think sometimes doctors hear patients say, oh, doesn't dairy make your mucus thicker? But in CF, well, first of all, there's not a lot of evidence for that. And then the second thing is that it's just a non-issue for people with CF. There are so many other things that make mucus thick.
Here's another one. When a CF person becomes an adult, this person put in his age around 25 years of age, does the body need the enzymes still? Do they ever outgrow the need for the pancreatic enzymes? Does the pancreas ever improve?
Well, unfortunately at this stage our technology doesn't allow that to happen. The pancreas is damaged very early in life, and that damage is not repaired by the body's own processes as time goes on. So if enzymes were required earlier in life, then they will still be required in the adult life as well.
Here's a question that came in live, and that is, what is the recommended units of lipase, protease, and amylase per gram of fat, protein, and starches respectively? Is there a formula that people are dosed with when getting pancreatic enzymes?
Yeah, I think there's 2 ways that we dose enzymes. One is to talk about how much lipase per gram of fat, and there is no recommendation for how much protease or how much amylase. So since fat has the greatest number of calories per gram, and since gaining weight is a problem, we really focus on that. And also, there are some other reasons why people with CF have trouble absorbing fat. So that's really the nutrient that's most important to us. So one way to dose it is to dose it by how much fat is in the meal. And people will say, well, anywhere between 1,000 and 4,000 lipase units per gram of fat that's in the meal. Another way to do that is to just make a dosage based on how much someone weighs. And so anywhere between 500 to 2,500 lipase units per kilo per meal, no more than 10,000 lipase units per kilo per day. And I think CF dietitians and doctors in CF clinic pay attention to that as well. But anybody who has questions could ask either the docs or the dietitians.
Okay. Here's a little bit different tact that came in live. For infants, is there any need for supplementing infants with CF, for supplementing breast milk so that they can get all the nutrients? Can most infants with CF get all the calories they need off of breast milk?
Well, we do encourage mothers to breastfeed, if they're able to do that. Always, growth is really what's important. So every time, a baby would come into the clinic, they're going to get their height and weight done. And if they're growing well and their weight for their length is growing at the 50th percentile, the mother should continue to breastfeed. If they do drop a little bit, they could maybe pump their breast milk, and they could add some powdered formula to it to increase the calories that way. But as long as they're growing well, they should just continue to breastfeed for the first year of their life if possible, or whatever the mother chooses.
What is or do we know why people with CF or kids with CF may not have a really strong appetite?
I think there are some medical reasons, and there are some reasons that we don't understand. Constipation is very common in people with CF, and constipation can make you have a bad appetite. lack of nutrients. If you're anemic, you may not have a good appetite. Low zinc is something that's also been associated with a poor appetite. Sometimes people have bad nasal polyps or sinus disease, and they don't have a good sense of smell, so they don't have a good sense of taste. People who take a lot of decongestants, that can be an issue also. It's a funny thing that decongestants can suppress your appetite. But I think there's some intangibles also. You know, the body's very complex, and there's a lot of feedback between the pancreas and other things going on in the intestine. There's a lot of intestinal hormones that help regulate appetite. And sometimes, you know, you've looked at all the medical causes, and sometimes people just really don't have a good appetite. And that's when using tube feedings can be helpful to take the pressure off of people. One other thing I forgot to say is if people are swallowing mucus and not spitting mucus out, it can make them feel kind of bloated. So again, this kind of connection between lung function and weight is very important. Airway clearance, exercise on a regular basis. It's all part of good nutrition.
And if I may add something to that, in the adult population, but in the pediatric population as well, you have to be on the monitor for signs and symptoms of depression, which alongside with chronic illness or other issues within the family or social setting, that can interfere with appetite and desire to adhere to the regular diet and therapies.
Great point.
What are some tips for starting a 9-month-old out on good, healthy eating patterns, a 9-month-old with CF?
I think if the family themselves are having good eating habits, they should instill those eating behaviors on their child. And also throw in a few extra calories, with some, butter or margarine in the food. But it's the family that has to have a good eating behaviors themselves and have a good, eating lifestyle, and that will spill over to the child with CF and really anybody in the family. If the parents have, lousy eating habits and stuff, then that's what the child's going to pick up. So it's the family that has to, be good eaters, and then that's, what will spill over to the child.
That you talk about the family. We've been talking so much about high-fat foods and extra additives. How does a family with members and kids without CF give the person with CF the calories they need without making everybody fat? How do they balance that cooking without making 2 meals and putting all that time together? Any tips?
Whatever the meal the parent has made at the table then is the opportunity for them to add the extra calories to the child that has CF. With butter, margarine, Parmesan cheese, onto the vegetables, grated cheese onto vegetables. They can use some dips for fruits, and also, like if they're having raw vegetables, dips for that. They can use snack time as a way to add extra calories if they don't want to add it at the meal, and then provide higher calorie snacks for the child. If they're a school-age child and they're in school, they can maybe use the nurse at school. They can go down to the nurse's office during school and have a higher calorie snack there. If the parents don't want to have all that high calorie stuff available for everybody else in the family, they could use a school nurse to provide a snack at school. But the main thing is to add extra calories at the table with whatever has been prepared.
Here's a question that comes actually from a grandfather, because he says that his grandson's physician says to let him eat everything and anything, and he's very concerned about how this eating will affect his heart system, his cardiovascular system, his cholesterol, and will it increase his chances of diabetes in the future?
Well, fortunately for the adult cystic fibrosis population, the diagnosis of cystic fibrosis itself seems to be even perhaps a protective mechanism against high cholesterol, at least as it comes from the diet. There are individuals who have a family history of high cholesterol, and from there, genetic factors more than their nutritional factors will place them at increased risk for high cholesterol. But the average cholesterol level for the adult population is between 120 and 130, and so they're not beset with significant high cholesterol levels. As far as risks for diabetes, it really is a process that is related to the breakdown of the pancreas, which continues as aging goes on. However, it is an interplay between both the breakdown and function of the pancreas in producing the insulin and the mechanism of insulin resistance, how well that insulin functions in the environment of the body. And inflammation plays a significant role in that. And by adhering to your CF therapies and eating a good diet and minimizing exacerbations, we can decrease those inflammatory processes and decrease how much they play into the development of diabetes.
So Joe, you said the average total cholesterol in the adult CF population is 120 or 130. Let's say someone without CF of a certain age walks into your office and you want to tell me what would be a good level of cholesterol for me. What would it be?
Well, a youthful person like yourself,
oh, thank you,
we
Joe.
would look for total cholesterol levels less than 200. You'd want ideally an LDL, which is your bad cholesterol. You would want that less than 130. More and more data is coming out wishing lower and lower levels of that for people at higher risk for heart disease. And you want your HDL, your good cholesterol, to certainly be above 40, but above 60 would be a protective level and actually help prevent heart disease.
So total cholesterol below 200 is sort of the goal for the general population, and here's people with CF whose total cholesterol is really most of the time 120 or 130, unless
Absolutely.
They have some special family history. So there's got to be something good about having CF, right?
Absolutely, but
Yeah.
every individual should review their risk with their individual practitioner.
So I think I heard you say that, or I should ask, is there anything that can be done to prevent somebody with CF from getting CF-related diabetes?
Well, CF-related diabetes, as we mentioned, is a product of the breakdown of the pancreas, which is the producer of insulin. And that happens in many patients, but not all patients. And the process of the diabetes seems to be a blend of what is in the common population known as type 1, which is insulin-dependent diabetes, where the pancreas isn't producing any insulin, and type 2 diabetes, where the insulin is there, but there is resistance to its function, and the insulin doesn't function as well in the body. And that is often treated with diet and restriction of calories, which we would never do in cystic fibrosis, and some oral medications. CF-related diabetes is a combination of those two, in which there is some insulin present, but not as much as should be present, and there also is some resistance to its activity. In terms of preventing it, the only thing that we can control, and we can only control what we can control, is the inflammatory component. The actual process of the pancreas breaking down is something that is an ongoing thing that will occur at its own rate, and at this time we don't have a way of affecting that. But by moderating the amount of inflammation in the body, by adhering to CF therapies and maintaining good nutrition, we would hope to decrease the effect of the pancreatic breakdown on the overall health of the patient.
You had mentioned earlier something about anti-inflammatory, and this question has come up a lot. Is there anything that a person with CF can do from a nutrition perspective to reduce the inflammation that is occurring in the lungs?
I think people have talked about that a diet high in saturated fat is an inflammatory diet. And the best advice really is everything in moderation. So probably the best diet is one that contains some saturated fat and some unsaturated fat. They have the same amount of calories per gram. I think that the amount of inflammation that's going on in the lungs of people with CF is so enormous that whatever amount of modulating you might be able to do through diet is probably somewhat small. Now people have talked about using antioxidants as a dietary component to control inflammation. Mm-hmm. So when you have inflammation, you make what are called oxygen radicals, oxidizing agents. So antioxidants are the response to that. Oxidizing agents, it's almost like rusting your body. It's something that there's always a little bit of control in the body. So there are some antioxidants which are very important for people with CF. Vitamin E is one of them. I talked about the fact that if you're not absorbing fat, you're not absorbing vitamin E, and that really is very important for people with CF. It's protective to their lungs. Vitamin A is another nutrient like that. There's been lots of animal data looking at giving animals antioxidants to control inflammation. It gets you very excited, like maybe there's some way to fix this. But what's been unbelievably disappointing is that the federal government has spent millions and millions and millions of dollars running huge studies on thousands of patients, looking at antioxidant cocktails to control heart disease or to control cancer, using things like vitamin E, beta-carotene, vitamin C, selenium. And in humans, either they've seen no effect or actually an increased incidence of heart disease or of some cancers. So the best advice is everything in moderation. Use the antioxidants that we think are helpful in CF. Limit the oxidizing things in your environment, like cigarette smoke is a very strong oxidizing agent. So, and we know for absolute sure that kids with CF who are exposed to cigarette smoke are going to have worse lung function. So that's our best advice.
How important is the role of aqua adeks in cystic fibrosis compared to other vitamin formulations? And this person is specifically asking about tocopherols. And I would say, what are they and why are they important in CF?
Yeah. Tocopherols are the sort of group of organic chemicals that are, of which vitamin E is one, and there's a whole bunch of them. And there are things that you can measure in the blood of people with CF that seem lower than in other people. Beta-carotene is a good example of that. Some of the other non-vitamin E tocopherols. And aqua adeks can increase those blood levels. What we don't know is whether there's a clinical benefit to that or not. We don't think there's harm. And again, you just end up in this balance of first do no harm. And I think you also asked a question about the additives for that.
Yeah.
So, you know, there are additives in everything in this world. The FDA has a list that's the GRAS list, generally regarded as safe. And so most medicines have ingredients in them that are added that are part of that GRAS list. And that's what's in the vitamins that we use.
How do G-tubes or tube feedings affect a child's appetite?
Well, a lot of times after, most of the G-tubes, they're giving their formula overnight. And sometimes in the morning, then they're not really hungry and they don't feel like eating their breakfast, but that's okay because they got a lot of calories delivered to them overnight. But usually as the day goes on, and most of the times by lunchtime, they're hungry and they're ready to eat, and they can eat normal meals, you know, normal lunch and then some snack, dinner, snack, and go to bed, and then do their feeds again. But it's usually the morning meal that they wake up and they're really, you know, not hungry. But we tell our patients, you know, that's okay because you just, you know, had your feeds overnight, and it's okay if you go without breakfast. But they should be able to resume normal meals by lunchtime.
Is there anything that is being used to help stimulate appetite for people with CF?
People have tried a variety of different medicines. You know, wouldn't you like to get your kid to eat? I think the problem always is risks and benefits. Prednisone really increases appetite. Prednisone controls inflammation, but in one very large study of people with cystic fibrosis, prednisone also, if you use it over the long haul, has some very negative side effects. There's a drug Megase that's been used in AIDS patients that can increase appetite. There have been a series of abstracts presented at our big national meeting associating that with some adverse effects. I think some people have used other medicines. There's an antihistamine, Periactin, sometimes works, sometimes doesn't. May be helpful, may not. That's a consideration. And I think the other anabolic agent that gets used is insulin. I mean, we think of insulin as something that regulates blood sugar, but it also kind of keeps your lean body mass, keeps protein in your system. And it's not exactly an appetite stimulant, but as an anabolic agent, something that's a medicine that helps you gain weight. If people do have CF-related diabetes, or if they have that sort of in-between area where they don't have a high blood sugar when they're fasting, but if you stress them, their blood sugar will go up, using insulin can be something that really helps people keep weight on their body. I don't know, Joey, anything else you want to add to that?
Only that there is also evidence now that insulin has anti-inflammatory properties and may have benefits in addition to that of gaining weight.
And we talked a little bit about antidepressants before. I think, there's some antidepressants that suppress appetite, and then there are some that tend to stimulate appetite a little bit too. So,
Well, I have a last question, and this came in during registration, and especially with summer coming up. And what is better to replenish fluids, water or an electrolyte drink like Gatorade? And what's good for a toddler, what's good for an older child, what's good for a baby, what's good for an adult?
I don't think one is better than the other. I mean, you want to make sure that people are having, enough salt in their diet. So that would be like the Gatorade or the sports drink. But a lot of times, that could be like heavier on the stomach if somebody's out there in a sporting event and running around. They may want to have some water. So I think like a little bit of both. I don't think one, all Gatorade or all water. But I think if they balance, both of them. With younger kids, anything like a little bit of juice, even like having milk if you want them to make sure they're getting enough calories. The whole thing is just enough fluids, if anything. Even things like popsicles and Jell-O and Freezy Pops, those are all considered fluids also. So just through different kinds of fluids throughout the whole day.
So it's with summer coming up and it getting so hot, lots of fluids and good salty snacks.
It's important to know that the thirst is the first sign of dehydration. So you should drink so that you do not become thirsty.
and people with CF, who have been studied in an exercise situation where they've been kind of losing fluids, don't have as good a sense of thirst. So you really just want to be using those fluids in a very preventive, proactive way.
Well, thank you, Drucy, Chris, and Joe. We encourage you to partner with your CF Care Center and find out how you can use nutrition to stay healthy. You can learn more about nutrition on the Cystic Fibrosis Foundation's website if you go under treatments and then click on therapies. There's nutrition information for all ages, information about enzymes, vitamins, tube feedings, bone health, CF-related diabetes, and a link to the Centers for Disease Control and Prevention's website where you can calculate your BMI or your child's BMI percentile. To watch an archived webcast about quality improvements in cystic fibrosis, CF research, patient advocacy related to insurance and government programs, building life skills to manage CF, total lung care, and how to avoid germs, go to the CF Foundation's website under Living with Cystic Fibrosis and click on Patient Education Webcast. As with other webcasts, this one will also be archived. I invite you to join us for the next webcast on caring for CF lungs on Thursday, August 16th from Akron, Ohio. You can check the CF Foundation's website later in July for more information. Please partner with your CF Care Center and ask how you can use nutrition to stay healthy with CF. In conclusion, I would appreciate it if you would complete the evaluation form and tell us what other topics you would like to hear about in a virtual Patient Education Day webcast. I would like to thank you for watching and submitting your questions, Drucy, Chris, and Joe for presenting, Women and Children's Hospital of Buffalo for hosting, Zach, Alex, and Carrie Sparbell for participating in the calorie contest, Lisa Madison and Peter Bradley for sharing their stories, the Cystic Fibrosis Center at Children's Memorial Hospital in Chicago for sharing their information about tube feedings, Judy Marcial for the graphics on the stomach and the pancreas, Rick Vasta and the technical crew, Genentech for the unrestricted educational grant, and the Cystic Fibrosis Foundation for making this broadcast possible. Thank you.